welcome to Hashimoto's Unfiltered, real talk, real solutions. The podcast where we cut through the noise and get straight to the heart of living with Hashimoto's. My name is Dr. Ray Benedetto, your host, and I'm here to share my expertise, personal insights, and from time to time, conversations with incredible guests to help you take control of your health. Together, we'll explore actionable items, debunk myths, and navigate the complexities of your thyroid health. So whether you're newly diagnosed or a seasoned warrior, this is your space for unfiltered truth and real hope. Let's dive in. Today's topic we are going to discuss, this is a question that I get very often, as you can imagine, which you can see as the topic of today's talk, is will I ever be able to get off of, or is there a chance that I'll be able to get off of my thyroid medications, especially obviously if I work with you and we get the Hashimoto's figured out and we get the Hashimoto's fixed, like what does that look like? Like what is down the road? Do you think I can get off my meds? And I get that, right? Most people who get to me, they're taking their thyroid meds. They're not thrilled about it because they were put on them and they were told like, okay, you need to take this for the rest of your life. And they were sent on their way, right? That's what the medical world has told them or has done with them or for them. So I get it. People come to me and they're just like, I want to get off these meds. Like I want to be off these thyroid meds. Okay. So let's talk about it today because again, I know tomorrow I'll get this question again. So now I'll have a talk that I can direct someone to and go, oh, look, I just covered this topic, yesterday or whatever. Here, check it out. So here's the thing, right? So the thyroid medications, yes, it's a medication, right? It's a prescription medication. It's not like having to take Oxycontin or cholesterol meds or blood pressure meds. Like basically what the thyroid medication is hormone replacement, right? Just like as if you were a male and you were taking testosterone when you get older, or you were a female and you were doing hormone replacement therapy like estrogen or progesterone as you get older, right? We're replacing the hormones that your body's no longer making, right? We're just giving them to you, right? We have what's known as endogenous production, meaning your own body's producing it. And we have what's known as exogenous production or supply, which is giving it to you from the outside in. So no different than like if you're an older male and you have low testosterone, they give you testosterone. If you're an older female and you're postmenopausal, you're doing hormone replacement therapy. It's the same thing, right? They're just giving you the hormones that you're not making anymore on your own. Now, some of that's part of the natural aging process. When it comes to thyroid, it's because your thyroid's not making thyroid hormones on its own anymore, okay? If you're listening to the sound of my voice right now, hopefully you know that the majority of the time, upwards of 90% of the time, 9 out of 10, that's due to Hashimoto's, right? That's due to an autoimmune condition. That's why your thyroid's is being damaged and is not making the hormones. So let's be clear about what the medication is. It's primarily T4, right? Which is the most abundant form of thyroid hormone that your thyroid naturally makes. So your thyroid makes T4, T3. Let's keep it simple. T4 is most of what your thyroid makes. So approximately 93% of your thyroid's normal healthy production is T4 and about 7% T3. It's not quite exact like that, but let's just keep it simple math. And then a topic for a different conversation, a different day, is that T4. The T3 is the more active form of the hormone. It's the part that's better utilized more efficiently by our cells, our body cells. So, but your thyroid mostly makes T4, but then it needs to be converted into T3. And that happens primarily in the gut and in the liver, primarily. Topic for a different day. But things that need to be considered as an aside when you're looking at levels and you're looking at symptoms and you're looking at blood work and all that kind of jazz. So that's an aside. But so most of what your thyroid makes is T4, okay? So the medication is primarily T4. Now you have your synthetics, you got your levothyroxine, which is the generic of Synthroid. You got newer ones to the scene, Tyrosint. You got more natural. Those are all T4. Those are straight up T4. And then your natural ones, your Armor, your Nature-Throid, those are desiccated bovine or pig or cow. So there's some T4 and T3 there. But Most of what's prescribed are the synthetics, right? The levothyroxine, the Synthroid, and it's T4. And so basically what your doctors are trying to do is mimic your thyroid, your thyroid's normal production, right? If most of what your thyroid makes is T4 and your thyroid's not making enough T4, well, we're just going to give you T4, no different than testosterone or hormone replacement therapy, estrogen, progesterone, right? So it's all it is. It's bioidentical thyroid hormone, right? It's synthetic. Yes, it's made in the lab. It's not your body's production. It's not another animal. It's synthetic, but that's what they're doing. It's bioidentical T4, just like bioidentical estrogen or bioidentical testosterone. So it's hypothetically bioidentical thyroid hormone. Okay. So that's it. Like that's medical treatment for hypothyroidism in this country. Your thyroid's not making hormones. We're just going to give you the hormones. And then your levels are normal and we're done. Right. And so that's what the medication is. Now, it does not take into account, of course, that the cause of the hypothyroidism in the first place is autoimmune disease, right? It's Hashimoto's, 9 out of 10. So the reason why the thyroid stopped making hormones in the first place is because the immune system has been damaging it. And so there's tissue damage to the thyroid. So now it can't make enough hormones on its own because there's too much damage done, right? So it's trying to produce hormones. It just can't make enough that you need because of the tissue damage, right? So, so then that shows up in symptoms and it shows up in labs. And then the treatment for it, medically, treatment in air quotes, is, okay, we'll just give you the hormone replacement. Those levels are normal. We're done. And then people don't get better because the underlying cause of it was never addressed, right? This is the bane of our existence. This is my mission in life. This is my ministry, is to get to as many people as you to be like, this is why you're not getting better. This is the problem. Medicine is ignoring it. We have to fix it if you're going to get better, right? The cause of the problem is Hashimoto's. That's causing the hypothyroidism. The medication they're giving you is not doing anything to address that. It's just masking the labs and maybe giving you some symptom relief, but even that, it's not really doing much. So that's it. Like, those are thyroid medications. That's all it is, right? Again, it doesn't help most people because 9 out of 10, it's Hashimoto's, which is an autoimmune disease, and the thyroid hormone replacement is going to do nothing to address the underlying autoimmune disease. So that's what we have to address for each person, right? That's what we got to figure out, and that's what we got to address on everyone, is that, right? Which is not done. I mean, I do it, but this is not done in medicine. So people come to me and they say, listen, I'm taking these meds. Awesome. Hashimoto's. Finally, I found someone to help me. Like, help me please do this. Like, how do we do this? How do we figure out, be my doctor. Let's do this, right? So I say, okay, this is the plan, blah, 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 whatever we're doing with that patient. And invariably, somewhere in the back of their mind, or it comes out of their mouth, is like, okay, great, we do all this. Does that mean I can get off my meds someday? And the answer is, it depends. Well, I'll give you a couple answers. It depends. Maybe. Honestly, probably not. Here's why. So the reason why someone gets diagnosed and put on the meds in the first place is because they became clinically hypothyroid, right? Underactive thyroid, because of the damage done to their thyroid, right? It doesn't work anymore. Like, part of the tissue is damaged, just doesn't work anymore. By the time people get to me, a lot of times that damage has already been done. And even calling off the dogs and getting the Hashimoto's fixed, they still don't have enough healthy tissue to produce enough hormones. So the reality is that most people will probably need to stay on the hormone replacement because the damage has already been done, right? Again, I know that's not what anybody wants to hear, and I'm not saying that's 100% of the time, right? I have patients over the years, we get their Hashimoto's fixed up, and they can get off the medications. They can at least reduce the dosage. That's more common than anything, right? And here's the thing. Okay, I got to take these hormones because I don't make enough of them anymore. I get that. But now they're actually working. Like, now they're actually doing their job because you're converting them properly, because we fixed your gut, we fixed your liver. We got all this inflammation taken care of. So now they're being absorbed by the cells properly. Your body is now, your physiology has been fixed. And now the hormones, whether your body's making them or you're taking them, the hormones are actually working. Like, they're getting where they need to go and they're doing the job they need to do. That's almost more important than being able to get off the medications. But the reality is, By the time someone gets diagnosed with Hashimoto's, by the time someone gets put on those medications, by the time they get to me, which is not usually right away, it's down the road, right? The damage has just been done. And it's just going to be really hard for someone to once again make enough of the hormones on their own. So the reality is, when someone asks me that question, like, will I ever be able to get off these hormones, these thyroid medications? My answer is probably not. But maybe, number one. Number two, usually can get it reduced, right? The dosage, as low as we can possibly do it. Excuse me. And then number three, even if you do have to stay on it, which is probably more than likely, now it's going to be working. Now it's actually going to be doing its job, which is taking the place of the hormones that your thyroid's not making. But we fixed your physiology and we fixed the Hashimoto's. So now you're actually using the hormones like you're supposed to. Whereas prior to that, we don't fix the Hashimoto's, throw the hormones at you, look at the blood work, nothing's getting better, nothing's changing, right? That's pretty much the reality. Now, how do we know? Now, this begs the question, because I get this a lot too, right? Okay, well, how do you know when it's time to reduce the dosage, or when we can reduce the dosage? Like, is that, after a month? Is that after a year? Like, okay, we're treating and managing the thyroid. Like, how do we know when it's time? There are two things we look for, either one or both, really. Number one is symptoms, right? So symptoms can go from hypo to hyper, right? And or when we do routine blood work, or we're monitoring these things, the levels, the TSH and the hormone levels and all that kind of jazz start to look hyper, right? So the numbers go the other way on the labs, which will again usually coincide with symptoms going hyper as opposed to hypo. Okay. So we see either one of those. If we see the symptoms, we check the blood right away. If we see it in the blood, it's like, are you experiencing these symptoms, right? So one will usually kind of work with the other. But if we see those things, that's our indicator to be like, okay, let's work with your prescribing doc to start gradually ratcheting down the dose. Most of the time, the prescribing doc will do that anyway. Like, if patients come into their office and they do blood work and they're like, oh my gosh, look at, your TSH is like rock bottom. They'll be like, all right, we got to reduce your medication. They'll usually do that anyway. But if we could do it before they do, then we just, okay, go back to your prescribing doc, show them these labs, tell them your symptoms, like it's time to reduce the dosage. And that's a good thing, right? That's the idea. That's the point of getting the Hashimoto's fixed, is to eventually get there. But the reality of it is, it's just more common to have to stay on them, because by the time you get put on them, there's just too much tissue damage to the thyroid to be able to make them on your own. So it's like, okay, I got to take them, but we still got to fix the problem. So we're using them properly, and then with an eye towards maybe getting off them down the road, more than likely reducing them, but most likely probably having to stay on them on some level. I hope that makes sense. Again, I know it's not what anybody wants to hear, but that's the reality. It's just the way it goes. So, and again, honestly, if you had to, like, there are worse medications you could have to be on. It's kind of a necessity at that point. It's not, I get it. Nobody wants to be on a quote prescription medication for life, but if you can't make enough of the hormones on your own, we have to get them somehow, right? We need them. They're absolutely essential. So we need to get them somehow. So then it has to be, all right, well, I guess I got to take them, but in the long run, it's not like having to take statin medications or like these harsh, nasty medications. There are worse things that we could have to go through in life, I guess. And if that's where we're at, it's where we're at. We deal with it the best we can. So hopefully that makes sense today. I hope you guys hope that everyone understands that. I get this question a ton. So now I have my voice saying it on a recording. So I could just fire this video off to somebody, or this talk off to someone when they ask me that question. So hopefully that makes sense to everyone. Hopefully that answers a lot of your questions. Maybe if you haven't even asked them yet, it's somewhere clanging around in your brain. I guarantee it. So that's the answer. That's just the answer. It's the reality of it. Is the way it goes. So hopefully that was helpful for you guys. I want to thank you for tuning in to Hashimoto's Unfiltered, real talk, real solutions. Again, my name is Dr. Ray Benedetto, and I hope today's episode help to give you the tools and the insights you need to take another step forward on your Hashimoto's journey. Don't forget to subscribe, leave a review, and share this episode if you think someone could benefit. You can also connect with me on Facebook at Dr. Ray Benedetto and on my website, drraybenedetto.com, for more resources and updates. Until next time, remember, you're not alone and real solutions are always within reach. Take care and be well.